this is on epidemiology and risk factors for hamstring and lumbar bone stress. Two big injuries in our sport. So probably what we're going to discuss is, how do we still get performance outcomes, knowing that these two injuries can get in the way and be barriers to performance. So what things can we do to understand how they come about and then put in some things that mitigate the risk while still getting performance outcomes, which is, essentially what we're here for. So a bit of a content, see if I can work out how to change slide. So a bit of session plan. We'll talk about some epidemiology on the hamstring strains. Then we're going to go to a discussion around the risk factors and mitigation strategies. We'll jump then to lumbar bone stress and similar a discussion on that. At the end, myself, Rich and Corey, is going to look to collate some of the answers, put that together and distribute to you guys out there. So hopefully you've got something to look at, refer back to, think about in terms of your application in your daily training environments. All right. Many of the slides I'm going to go through are going to have a lot of stats, numbers. I'm going to briefly just brush over some of it. I've put more detail than's needed, and some of that's because you can then refer back to it if you want to. You can rewatch it and look at some of those numbers and data as we go along. All right, so first up, pretty busy slide, but we did an epidemiology review. So that's, looking at all the injuries that occurred between Tokyo Olympics and Paris Olympics, so that 3-year cycle. And on this, the green line shows the accumulated time loss in number of days lost from all the athletes that got each particular type of injury. And the injuries are broken up into a tissue type, say a muscle or a tendon or a bone or joint, and then which area of the body. Now, the key ones we're looking at are the ones on the far right here. And in number one place, we have thigh muscle injuries. So thigh muscle injuries were the biggest burden or biggest time loss, accumulated time loss of all the injury types that we sustained in that 3-year period. So hence why I want to talk about muscle thigh injuries. Out of all muscle injuries, again, you can see here that predominantly they're all thigh injuries of all the muscle injuries. A few lower leg, which will be calf, and the thigh, just to be clear, is hamstring, quad, and adductor. Approximately, we're seeing about 15% of all the injuries we get are hamstring injuries, and thigh muscle injuries, approximately about 19%. We'll go into some deeper data here on just thigh muscle injuries, and we can see that if we're getting a speed type athlete, a sprinter, pole vaulter, horizontal jump, multi-event athletes, approximately 30% of any injury they get is a thigh muscle injury. In terms of risk, that is how many you can expect to see in a single athlete in a single year. So for a sprint hurdler, there's a 37% chance that they get one thigh muscle injury per year. Or you could look at it as if you had 100 athletes, you'd see 37 thigh muscle injuries out of that 100 athletes. That might be some unfortunate fella that gets 37 of them, or it might be spread evenly amongst that cohort. If we look at time loss as well, which is the severity and average, anywhere around about, somewhere about 40 to 50 days. It can be in this record a bit lower in the pole vault. That's can be due to higher reporting of incidents of smaller type injuries that leads that down, and you can also see a number of injuries here in the walks as well. Keep moving on. If we look at this as all muscle injuries and the ages at which we see them, the blue line's how many we see accumulatively we saw over that 3-year span, and then the orange line was the risk that you could get a muscle injury over that time frame. So the risk didn't seem to change a whole lot as we went along. We see the incidence go down, and that's largely because you see a dropout of numbers as athletes get older. Breaking that down though now, when we look at this blue graph here, this is all thigh muscle injuries. And the orange graph is, pretty much calf injuries. And you'll see that at a younger age, people are more likely to get a thigh muscle injury, and that dips down. And not surprising to many of us who've been through it, as we get a bit older, we're more likely to get a calf injury. Looking specifically at the sprint hurdlers, you can see that there's a pretty sharp peak between that 20 to 24-year-old age group, where we saw 80% risk of getting a thigh muscle injury in that 22 to 23-year-old age group between Tokyo and Paris. So, if you were a 22 to 23-year-old sprinter, you had there was an 80% risk or chance that you'd get at least one thigh muscle injury in that period of time. So pretty damning results there, and something to really consider. Questions about gender and age, and which we often get. So gender, if you're looking at purely muscle injuries, men, have a greater risk at a younger age, we saw than women. And it sort of evens out a little bit. You'll see the same trend in thigh muscle injuries. So men more likely, or males more likely than females. The younger age evens out, whereas calf injuries seems to be similar risk, male and female, along the age groups. So on that quick summary so far, so we know that thigh muscle injuries account for the largest incidence and burden of all the injury types that we saw. Hamstring injuries are approximately 15% of all recorded time loss injuries. So that's injuries whereby they have to either modify their training or have no training for at least one day. They're the most prevalent in high-speed athletes, sprint hurdlers, horizontal jumpers, pole vaulters, but I've also just put walks there. I know they're not high speed, but we see them in those athletes. The greatest risk seems to be in athletes around that 20 to 24-year-old age group. So, questions why, there's plenty of potential reasons why that's the case that we might explore. And up to 80% risk in some athlete groups in some years, especially the sprinters and pole vaulters. And we saw a greater risk in males than females when under 20, but evens out. So off the back of this is where I want some crowd participation, if I may. What do people perceive are the risk factors for hamstring strains? So I'd love to share what people's thoughts are.
Can you turn your microphones off and on? Turn your microphones on.
Yeah, Kev, are you talking like specific measures from like a training standpoint, or are you talking like strength measures? What are you talking about in specific?
Yeah, so that could be in training factors. It could be strength stuff. What would you guys as coaches or girls, I shouldn't be specific to sex, what do you people out there, coaches out there, think are your big risk factors? What would you hang your hat on?
Total number of high speed meters in a week. Exposure over like a elongated period of time, race schedules, travel. Could be like, you could look at like your eccentric strength capacity, concentric strength capacity, rate of contraction capacity, depends on the type of injury, obviously, in the hamstring. And you can look at isolated factors, all of those. Could be a range issue, could be like a lot of different areas depending on the athlete and the event. Yeah,
cool. So, your first points around, high speed running meters, should we explore why that's a factor? What that means? Is it too little or too many, or what are we thinking about there?
Could be either. Yeah. So like not enough exposure to the task, and then potentially racing too soon, or having too much, or trying to race under fatigue, or contested reps under fatigue. Now, use of things like 1080s, assisted running is really common. So also utilization of those things under the wrong context or under the wrong mechanical models or technical models.
Yep.
Okay.
I just noticed a question in the crowd, so yeah, you go, Mark.
Andrew Beck, can you turn your microphone off? Yep.
Yeah.
Go for it.
Yeah, you got me. Yeah.
Yep.
So obviously, leading on from that, I mean, fatigue is going to be an intrinsic measure per athlete. So it's not, we're tracking sort of meters at speed per week, etc. That's going to be highly dependent on individual athletes and their age and their training age and the point of the year and things like that. But I think it boils down to different fatigue levels and how that impacts with like lumbopelvic control. So recognizing when an athlete's under a certain level of fatigue or duress and mechanics sort of break down, and obviously that's going to lead to overload somewhere because load's always looking for somewhere to go and the chain breaks at its weakest link. So, trying to manage that sort of internal load from each athlete independently, because, depending on training status, age, all these different factors is how they're going to handle fatigue. And obviously in a particular time of year, you're looking for that cumulative overload and pushing aerobic envelopes, but coming back to that competition stimulus and things like that, and travel and all these things are sort of underpinned by that inherent level of fatigue, which is going to directly impact your stability in that lumbopelvic region.
Agreed. Yep.
Just a question. There's a question in the chat just asking for the stats. Were they just NAS athletes?
Yeah, so these are only athletes on scholarship, or if you want to call it NAS athletes. Yeah, so only NAS athletes.
Okay.
There were very few of the 16 to 18-year-old athletes, so some of those numbers can be a bit inflated. Also, the only injuries that are recorded or known about, I should say. So sometimes, we get injuries happen to athletes and it's just unrecorded, unknown. So there will be missed data. So it's only the things that have been captured.
Okay. Can I ask a question then? Just the risk factors. My perception is that range is important, but I'm not sure whether the research perceives that. Like athletes that are just not very flexible seem to be at a high risk. The ones I've coached over many years, I don't know whether that's good. I'm imagining it or whatever it is. Hence, we do quite a lot of stretching, which I know can be controversial. So I'm just interested in what the experts say about that.
Yeah, there'd be no evidence behind it. That doesn't mean it's not factual, doesn't exist. Sometimes there's things that we see that it's hard to get evidence around. That could be because it's individualized to a certain athlete in terms of their mechanics and biomechanics. Essentially you want to have the range that enables you to complete the movements you're looking for. Of anything, it'd be more the hip flexor and range of the hip flexors. That would be the strongest link to it. There's been some little bits of evidence there, but in terms of hamstring length, not that I'm aware of, Mark.
Okay. Yeah. Thank you.
I think, we've named things around from an Oracle call, people mentioning about velocity and exposure to velocity, fatigue. We've mentioned, probably both in the chronic sense and the acute sense as well. I think there's been a touch upon biomechanics there. Does anyone have anything else or want to explore any of those things a little bit more?
Sorry. Yeah, just a question to your comment on hamstring length. Why do you think that we try and increase fascicle lengths by doing like Nordics or super maximal eccentrics if length is not a problem or not an issue or an indicator?
Because length is a combined total of not only their muscle fascicle length, but also the pliability of the compliance of the tendon as well. So it's the muscle tendon unit. But you have touched upon one of those risk factors is fascicle length. That is something that has been linked in the research. So yeah, it's fascicle length's important, and that's a part of the muscle tendon unit, but not the whole component, if that makes sense. Yeah, that would be my only explanation behind why that's the case. Anyone else have something to explore there, or Corey or Richie, any additions or other thoughts?
Sorry, yeah, I just chucked my hand up.
Yep,
So
go, Corey.
yeah, I think so. We've covered like biomechanics, we've covered length, but we probably haven't really covered much more beyond that. So I'm just thinking of the conversation I had today, Kev. So in terms of strength factors, or in terms of so you're asking a tissue to do a certain amount of work at a certain amount of intensity, and then you're either over or underexposing it, and that's been mentioned before from a biomechanical perspective. But outside of biomechanics, obviously we've got other forms of training as well. So if you look at things like strength training, what do people think could increase risk factor for a hamstring strain from a strength perspective?
Irina?
Hi guys. I had privilege to work together with Craig Pedam. He was physio for my squad, and we were discussing with him this subject a lot. I learned big deal from him. And what we came about strength, Corey, about your question. I think that we're not doing enough strength for small, deep muscles, because hamstring is complex. It's not only biceps femoris, everyone know. And we have deep muscles that we're not making strong enough. And we were talking with Craig a lot about varieties of exercises, that most exercise direct to make stronger big muscles. And the same, we're not strengthening glutes enough, because if glute not strong enough, hamstrings are overloading. It is from my experience. And glutes, it is complex as well. It is not only glute max, med, mean, it is external rotators like gemellus, piriformis, and other muscles. I think we're not paying enough attention for these deep, small muscles, and paying more attention for big muscles that on top. And yes, we were talking with Craig a lot about varieties of exercises that could cover all hamstring complex and all glutes complex. I think it's one of the risks that we little bit disproportion with exercises and varieties.
Fantastic. Yeah, that's exactly what I'm hinting at. Thank you, Irina. So we talk about that biomechanical link. So there's strength factors that underplay that. It's not just fatigue or the athlete's skill to be able to do that. So making sure they're covered off in the gym, i.e. lumbopelvic, i.e. stabilizers, because some of those things will change that length tension relationship and how quickly and how much stretch you get on the hamstring as well.
Yes, and very important that we have not only varieties exercise, we have right order of exercise as a training session, because it's not only gym session, it's a lot of drills. I'm quite big on drills to make stronger muscles and mobility. And first stage of recovery happening during the training session. And very often it's depend what order of exercises we have. That recovery was happening already during the session when we're doing training.
Brilliant. Has anyone else got kind of any ideas on the biomechanics, strength, or anything outside that could be a risk factor for hamstring strains?
One more thing I wanted to say, sorry, that it's individualization training session as well. because if one exercise good for one athlete, maybe for another athlete, we need to change and do something different because all of them different, shorter muscles, longer muscles. Yeah.
Yeah, so individualization as well.
Yeah.
Of those three, Kev, is there anything else you can think of, or do you guys want to move on with the lumbar stuff?
Well, I was just thinking, why do people think we maybe see this greater risk at this younger age group? This 20 to 24-year-old age group. What are people's opinions and thoughts on that?
I was just going to say, rate of development of speed is not matched with tissue capacity and development of strength qualities. Athletes tend to do high speed running from a young age and develop those qualities quite quickly. And whilst going through body changes and stuff, their strength is always generally delayed to that. And the peripheral tissue just cannot tolerate the loads that we're trying to demand of them.
Yeah, great. I like that answer. That fits with my bias as well. Great. I might, if I can, move on because I think it's important to go to the next part, which then we try and tie a bow on some of this. So, if those are some of what the risk factors that we're thinking of, how do we as coaches plan and adjust training to mitigate the risk of hamstring strains while maintaining a performance perspective? What do people either already do in practice or have ideas about in doing?
Presumably, you need to grade the training based upon the training age of the athlete and the actual age of the athlete. That's one thing.
How do you think you do that then, Mark?
Well, you're setting very, very generally lower loads for younger athletes. That's and then progressively increase them as they mature. That's the main thing that I do. Is try to, they don't do everything that their senior athletes can do. Yeah. I think Vass has got another question or comment.
No, I was just going to say to that comment, Mark. I think you just measure it. I think if we've got some capacity to measure these things, whether it's as simple as a fly run or capturing of what relative top speed is, capturing data and their strength as much as we possibly can within the means of what's accessible, to then try and make sure that the tissue capacity is going up at the same time as the development of speed, to ensure that we can sort of mitigate those things and going across contraction types, making sure we're not just developing eccentric strength or concentric strength, which is something that I feel like I commonly see people just go, yeah, do Nordics and you'll be fine. And that's a very short-sighted view of, I guess, the broader epidemic. And ensuring that you're going, cross contraction types, and ensuring that they're able to continue to perform whilst their speed's improving. And that's just comes down to their chronic training load over their acute.
Okay. And Irina?
Just from my experience, one of my athletes, Evan O'Hanlon, had stress fracture L4, L5. And it is happening in 2007 when he had full-time uni, he has training full-time, and he was building business, cafe, and a lot of heavy work. And when my athlete's injured, I all the time digging in my head, what I did wrong. And I think he was overloading his body with not enough recovery, that it's very important to know how much recovery athletes have, that coach can monitor load, volume, and intensity. And if not enough recovery, something happening in their life, that we need to monitor this. And from my experience, I'm coaching athletes at the track and I'm coaching athletes at the gym. And when I see them at the track, I could see what is missing. And then I can change gym straight away the same day. It's what is working for me. But I could not avoid with Evans this injury because he was overloaded from other stuff. And what this was big call for me, how much coach need to monitoring recovery. Even we know we have to do something with training and intensity or volume. And if something going in their life outside training, we need to know about it and change training sessions straight away.
Great. I'm intrigued to, and it doesn't have to be you, Irene, it can be others as well. You know, on that, what are people's monitoring strategies that they're employing to adjust the training that you're delivering on the day?
Adjusting. When my athletes coming to the track and walking towards me, I can see by their walking what is going on. And straight away can ask a lot of questions. Did you sleep well? What did you do last night? It is, I can change training session on the go because I just know how important it is and to avoid injuries. And it's how I'm operating.
I mean, not even just on the day. I mean, I will schedule things. You know, they've got exams, okay, so we'll train. I don't want them to do nothing during exams, but they'll have certain things written down to do, a smaller session by themselves, but they need to do it and they need to report on doing it. But, that's that or other things that could be in their life. That's really important, I think. But yeah, and talking to it and finding out what's going on. As Irina was saying, watching.
Yeah, I think that's really great points as well, Mark, about the life loads. Anecdotally, I don't think we've got research to back it up, but anecdotally, we do see that many injuries occur around significant life things that are happening, whether that be exams, relationship breakdowns, family conflict. We do see that sort of stuff link. Back to Vass's point. You mentioned Vass, and again, you don't have to be the one that answers, it could be anyone. You mentioned that sort of that misalignment between velocity and strength. So when you're seeing an athlete that, is running faster than you think they've got the strength capacity for, what are people doing in that instance to then adjust, their load around that?
I don't know if the question was directed at me, Kev, but I'm happy to answer.
I'm throwing it out to the floor, but lovely to hear you. Yeah, you keep going. It's great.
On your sort of readiness indicators, like someone, for example, like Liam, he does a drop jump as an indicator for his readiness, and he just sort of collates data over an extended period of time just before all of his sessions, and then we do a correlation between his drop jumps and like how his session goes in terms of intensity and velocities. Trackers max V. We look at obviously like other measures, just like his HRV, his resting heart rate at night. We look at the week, look at the averages, especially when he's traveling a lot. All those sorts of factors. But in terms of looking specifically at maybe like a younger athlete that might not have the peripheral tissue capacity, I generally just have like sort of markers that I've used either through research or experience or whatever. So with those athletes, I tend to try and flatline their speed and be like, run to where is comfortable whilst having a considered effort to increase what their peripheral tissue capacity is over a however long period, pending the time of the year and what their strength limitation is, whether it's max voluntary isometric contraction, the eccentric capacity, the rate of contraction, whatever that specific domain is, and having exercises directed particularly to that.
Great, thank you. I suppose, we mentioned early on about, velocity, exposure to velocity, either too much or not enough. I'm interested, how many people out there, they measure it, quantify it. If you do so, how do you do that? Record that, plan for it, etc.
I can see a comment from Vic Khan. Vic, do you want to elaborate?
Just a quick one, Mark, that when you guys were discussing life load, and certainly we've been talking a lot amongst performance support teams about integrating multidisciplines, and you'll obviously be hearing from Kate Wensley, who's our network lead psychologist later in the year. But one of the points that she actually raised last week in a discussion that we had was, knowing that there is a bidirectional relationship between mental ill health and injury. So, not ignoring that life load, I think, is probably just the take home there.
Okay. Good. Is Alistair, you've got a comment?
Yeah, just with what you guys were just saying, I just have the stopwatch out regularly, and I've just got a copy of their Flying 30 on my phone. And then if it looks like they're moving off that percentage that I've sent, then that's an indicator that I need to retest and adjust, or like some of the others mentioned earlier, checking in with them at the start, and if they're looking a bit stiff, encouraging them to warm up a bit longer, or just do a skip in start or something that just takes that little bit of load off, and just increasing recovery times and the volume of the session. But just keeping track on these key metrics, are they behind where I expect, or are they in front? Because maybe I need to adjust the numbers and the planning.
Yeah, cool. Great. Thanks for sharing. Anyone else got other ways? I'm not saying that there are other ways. I'm just hearing what other people's experiences are in there, or that's the common way. Another thing I'm thinking as well, I'm just throwing it out there, is do people put in or plan things around just external pressure? I'm thinking, come to a race situation, we're away from training, we're now in a competitive environment, and people tend to, often run faster in a race with that extra motivation, but then they've got people that might start quicker than them and they're chasing them, or they're having to really work hard over that last 20 meters or whatever it might be. Do people think about or explore ways to add external challenges to the athletes?
You're talking about setting up testing periods and things like that?
Yeah, it could be. It could be setting up, in an in-training race. You might give someone a head start, or what's other constraints that you might do just to put something on the line, put it I don't know, put a Coke on the line or something. I don't know. Yeah, just something that to add motivational challenge or stress or something. I'm just thinking, we do see some athletes get injured in races, and you go, okay, they're peaking for this period of time, probably tapered, should be in peak performance, but they still get an injury. So what are we seeing that accounts for that? Is it's probably many things, but one thing may be the external environment that they're exposed to as well, as a hypothesis. Yeah.
I mean, in training, you want to try and have periods where there's maximal effort, and I mean, I've always found that setting up competitions in training is a good way of doing that. Bigger efforts at training make bigger improvements. I mean, we use sleds, but we use different weights for the different athletes, so we have an even race, so they try and handicap it and all that sort of stuff. So
yeah, cool.
I mean, I expect a lot of people do that sort of thing, but yeah,
that's interesting.
Irina?
It's the same, like Mark said, we're doing some races during the session, but from my experience, I'm talking from my experience only. 2 weeks before big competition, I have long taper, and 2 weeks before competition, I'm not doing anything like trials or another competition, lower competition, because I found that all body getting tense before competition, because it's just tensing by going to be ready, and better to not tense them even more, to put some races week before, 5 days before, because they're already tense. And I would like them to be as fresh as possible, that they can have buffer to run fast. They will tense anyway, but I don't want extra tension for them. So last competition for my guys before big race maybe will be 2 weeks at least, maybe even more. It is just from my experience.
Right, thanks. Yeah, so in that maybe it sounds like there's a space for sports psych as well, in managing our emotional state into races. I think we could talk about some of these things for another half hour or hour, I probably could. But I'm conscious I want to get to the lumbar bone stress stuff. So as I mentioned, Cory, Richie, and I will just put together some of these discussion points that people are talking about, maybe some extra ones, and send them out just for some thought. And the discussion can continue to happen offline and beyond this. So quick one on lumbar bone stress. Again, when we go back to this epi data, lumbar bone stress in terms of burden is our third most burdensome injury in terms of cumulative time loss. We don't see many of them, but when we do see them, they we see people out for about 6 months or so of mistraining on average. So I just wanted to quickly go through again some of these slides. I'm just going to rush through because I want to get to the discussion point, but you can come back and have a look at the data on it. But in terms of bone stress, about 10% of bone risk of bone stress injuries in athletes. The lumbar bone stress, we had 13 of them, which was our largest number of type of bone stress. And lumbar bone stress and foot were our biggest time loss in terms of per an injury. The interesting thing that I still find interesting is, since we've had those super shoes come in, we haven't seen foot stress in distance athletes of anyone that's been on scholarship. So I just find that a fascinating point. And that continues to this day of any of our scholarship athletes, no foot stress in the distance runners. And I could talk about that again as a whole nother topic, but I won't hijack it, that part of it. Again, this is just a slide for everyone to refer back to, but the event types where we see lumbar bone stress and foot bone stress, with the dark blue here being distance. So distance, we see these thigh and leg injuries, bone stress, but in the sprint jumpers, we see lumbar bone stress, and throwers, we see lumbar bone stress and the foot bone stress. Age-wise, in general, we see more injuries occur at a younger age before an older age. But when we break it up into event groups, orange here is our sprint jump athletes, and we see a higher risk of injury at a younger age, which diminishes as they get older. And that may be because there's an attrition, they get these injuries and they are no longer competitive and performance ready, and they drop out of the sport. General attrition in the sport as well. It could also be, as Richie will touch on, in terms of bony maturation. As we're younger, our bones aren't as hard and ready for the load. So we may see a greater risk there as well until the body catches up, especially with these, these are high intensity sports, power sports, onto the lumbar spine and the foot. Whereas in the distance, if we got rid of this data, the 16 and 17-year-old, which, as I said, we didn't have many numbers of 16 and 17-year-olds, so I wouldn't trust that data completely. But, it's probably more even across the lifespan, the risk for a distance runner. And that may imply that there's, similar load-related issues the whole way through, REDS issues as well that account for some of those. But it's interesting the difference between the two event types. By age and gender, pretty similar across ages and gender, except this younger age we saw greater risk in the female athlete than the male athlete in that youngest age group. Specifically to lumbar bone stress, again in this younger age group, we see them. There's definitely plenty that happen in that 16 to 17-year-old age group. They just occur before they end up on scholarship. So when they come, we see many athletes come onto scholarship in their history. They've had these injuries, but they're just not on scholarship at that age group as yet. What's interesting is we're seeing a number of sprint hurdlers getting these injuries as well. I feel like we're identifying more and more and more of these happening traditionally, as Richie will touch upon, being in pole vaulters and javelin throwers and multi-event athletes, but we're seeing a heap in these come through in these sprinters. Of these, as far as I can see at the moment, they're all 100-meter, maybe out to 200-meter runners, but not 400-meter runners, which is an interesting point as well. All right, Richie, over to you, mate.
Thanks, Kev. On the screen is just a summary of the pathophysiology of development of bone remodeling. On the left being adaptive, good remodeling, and on the right being sort of the more maladaptive process, which can lead to bone stress and a stress fracture. But the basic principle of some load is good for bone, too much load will break it. And where that tipping point exists is quite varied and influenced by a number of factors. It's specific to the bone, it's obviously specific to the person, their age, their bone strength, their loading, and also their recovery from loading to allow that adaptation left circle to do its thing. I guess we'll touch on some stuff we do know about lumbar bone stress injuries, and they lag in development. All bone stress injuries do. Maybe lumbars present even a bit later. So some cricket data, high load for the preceding medium term, 12 weeks, put you at a greater risk of a lumbar bone stress injury, or a low career workload. Probably you haven't had enough of that adaptive good bone loading, and bone's not as strong or durable and resilient. And also if you have both, so high medium term load, low career load makes you at increased risk. And that probably brings to the point about, some of those times when athletes are going well, they've had a really good training block, been performing well for 3 months. We're obviously all here for performance outcomes, but as a doctor, I'm the pessimist in the room. So just thinking about what's the mechanical load tolerance after that sustained load. So and thinking about mechanical load versus physiological load. When someone's had good consistent training, how do you maintain and progress physiological loading without overloading their mechanical system, bone in particular? Next, Kev, thanks. Just click through till you see the 4 pictures if you can. So what we know, a lot of what we know is from other sports. There's not a lot of, there's probably some knowledge in this room, of course, about athletics and lumbar bone stress injuries, but not a lot of scientific data. A lot of that data is from other sports. So the things that put this area, the arch at the back of the lumbar vertebrae at risk are trunk extension movements, rotation, side flexion, and they all cause shear and bending forces in the vertebral arch that make it vulnerable. And then also high ground reaction forces, impact forces, and axial loading contribute. So just thinking about some specific sports where the incidence of this is high, cricket being one of them. I think that's Peter Siddle there. So that sort of high impact forces as they plant the front leg, and also rotation, fulcruming on the contralateral to the bowling arm side. So for that bowler there, their left-hand side is where they get their lumbar bone stress injuries. And there's other sports, more unilateral sports like tennis or javelin throwers, as we mentioned, where they can get them on both sides. Again, the combination of rotation and also impact forces. More symmetrical sports, some of the jumpers, high jumpers, gymnasts is pictured there. And gymnasts, of course, have high impact forces as well as rotation movements. And then there's another group which might be of relevance, particularly to some of our sprinters, is weightlifters also have a very high incidence of lumbar bone stress injuries. And, you know, it's not a sport I work with much, but I don't think they do much running. There's not a lot of impact forces, but high axial loading forces. What else to know about lumbar bone stress injuries? They're in the bucket of high risk bone stress injuries with the anterior tibia, navicular and fifth met of ones that can take a long time, as Kev outlined, but and also be prone to not healing well or reoccurring. And we also know recovery and management differs by sport, by athlete factors, and also how early they're picked up. The earlier they're picked up, a stress reaction heals quicker than a complete stress fracture. Yeah, I think that'll do on that actually. Thanks, Kev. So just briefly, as touched on already, we see this more in younger athletes. It's not specific to athletes across all sports. And those that are less skeletally mature get more bone stress injuries, and that's true for lumbar bone stress injuries too. In general, your peak BMD, your peak bone mineral density, peaks about 6 to 8 years after your peak height velocity. So the graph there is about peak height velocity. So what that equates to, and specific to the lumbar spine, was your BMD around your lumbar spine probably peaks between 18 and 20, and a bit later for boys, for men. And again, in cricket data, where there's a lot of data, you're about 4 times the risk of a bone stress injury in your back if you're under 22. Next, Kev. Last slide for me is that this picture on the left is from the Sports Medicine Bible about how to examine the body. And this is you get them on one leg and you do a hyperextension and rotation test. It's there's some tests in physio medicine which are really accurate, and there's some that are not. This is in the not accurate bucket. There is no good clinical examination for lumbar stress fractures. They're sitting beneath a big chunk of muscle, so you can't palpate them like you can with a tibia or a bone on the foot. So the point I'm trying to make is they tend to present late, and it's really hard to distinguish between facet joint inflammation or just a non-specific tight back and an early lumbar bone stress injury. And I think the longer I've been around, the more I realize that, you know, there's no one who's very good at picking these up early. So the key message there is they're hard to distinguish. So we image early in an athlete that's at risk, you know, a cricket pass bowler, a gymnast, and probably in that group, a young sprinter, a javelin athlete, multi-athlete as well. If they're high risk and they've got lower back pain, we go to thinking about a lumbar bone stress injury early, and we image early, where there's quite specific imaging techniques that are good at picking them up early on those images on the right. That's all from me. Kev, you want to ask the questions and round it out?
Yeah, so quick summary of what we talked about. So lumbar bone stress are the third largest burden of all the injury types. If you get one, we're typically seeing around 6 months missed training. You know, not just a throwers and vaulters injury. We're seeing these 100-meter sprinters getting the young athletes, the developing athletes, and more often than not, as Richie touched on, they're identified late, and secondary to that, they're often a little bit more significant than had they been if they were picked up early, and therefore result in some longer time loss. So back to those 2 questions we asked before. Sorry, Mark, we might be going over time. I don't know if that's a big issue or not. But you know, what do you perceive are the risk factors for lumbar bone stress? Kerry.
Hi, thanks. I'm just in Brisbane, and I've got a few older athletes, but I do have a lot in that category that you don't follow. And there's a couple of comments. One is that the athletes that we're working with that are really good are doing multiple sports, and so you've got a lot of studies around cricket and things. As soon as one of my athletes has a sore back, you know, you have to look at what they're doing. They're doing a bit of cricket at school. They're playing some rugby, they're playing some soccer, and they're also doing track and field. And all of a sudden, you're having those issues. And so even though you're working at that other end where they're already scholarshiped, you know, it's just a disaster, you know, in terms of that for them. And so they're not managed in that sort of situation. The other thing, and this is a little bit of a criticism, I guess, but it's a bit of a frustration. Sometimes my athletes, and I've had some that have had these types of, you know, injuries, they do present to me or to them quite early. They can identify, you know, the aching headache bones, the sore back or whatever. You send them to a physio and the physio hangs on to it for too long, and they manage them from a soft tissue perspective without imaging, and they seem to wait until, you know, it becomes so chronic, because the athletes are have such high pain threshold. I'm a middle distance coach mostly, that they, you know, they get sort of like an assurance that they can keep sort of pushing through a little bit. And so they're not managed right, even to the point where you might have them doing a PE lesson and they might have, you know, a sore shin or like, you know, some sort of stress reaction happening. But just doing PE 3 times a week, doing European handball after having something that like that tips them into a really chronic situation. So, and that again is sometimes managed by a physio that isn't quite being aggressive enough. So that's just my comments on it.
Love it. Thank you. It's one of my bugbears as well. So thanks for sharing.
I think on that,
Oh, sorry, Richie, sorry, you go.
I was saying some good points there. We talked about, you know, the life load of the, you know, the professional or high performance athlete and their uni, etc. load, but you know, pointed out a good point. There's other loads as well, particularly in that sub elite category. And then I think, yeah, it's a good point. It's and physios, docs as well. There's people that don't necessarily pick up on it early, and we and others try and educate on that front as well and try and promote the knowledge. I think sometimes, you know, the good people will know if a coach is concerned, and they'd be concerned too. I'm based in Canberra. If Irina came to me and said she was worried about her athlete, that would make me worried too. So I guess, you know, the coaches are at the forefront, so they're often the ones that'll pick up on this stuff. So, you know, there is a role for advocating and advocating to the practitioners too.
I think we've got a few hands up. Matt Horsnell.
Yes. What I've seen with those injuries is iliopsoas is a big one that I see that if it goes on unchecked, and that can be quite tight in the early stages, especially with high-powered events where you're having a lot of hip extension, and if that's left unchecked, you know, I've seen that go right through to major back issues. And keeping over 20 years, I've found athletes who can keep iliopsoas under control, especially some that are prone for that, if they, especially in the study period, like when they're doing a lot of uni stuff, sitting down a lot, and then stress, and that is so tight there, and then they all of a sudden put in a big session, they're going to have issues with their back. And then as soon as that starts to tighten up, I've found that gluten and meat will tend to compensate, so they'll lock up to protect, and all of a sudden you get more rotation and you'll end up with some knee issues, or, you know, just ongoing, like a little cascade of problems from iliopsoas. I've found is one of the big issues that, especially with some athletes, when they go through a peak growth phase, they'll stop growing, but their body changes, especially through the hips. With girls, there'll still be a change that causes a lot of those issues to tighten up through that period when they're doing a lot of study stuff and sitting down. And a lot of athletes I've seen that after 21, 22, they get through that period and they tend to retain strength more, and they have less and less of that type of issue. But definitely, like, number one for me, if the athlete starts to have a problem, I look straight at the iliopsoas and see what's happening there. And we go through a program of trying to lengthen that out over time and work with a physio to do release quite often. And I found from that we can get through and progress quite well, especially after long haul flights, big flights. Iliopsoas want to shorten up, and if you do a competition straight up, and you're into big loads, like what we do over time is at least try to get in a week before for a long haul flight, have a gradual slow recovery, slow running and easy work, and then we don't tend to have any issues. But just from experience, that's my big problem that I've seen over the years. I don't know whether any other people have seen that with physios and with the work you've done. Yeah.
Yeah, look, definitely, Matt, you can definitely see that tightness in the iliopsoas, and then you think about the whole kinetic chain. If you're tight through your hip flexors and it pulls you into anterior tilt, what does that do to the lumbar spine in terms of the extension pattern, lordotic pattern that it puts in there? Especially then as you go into hip extension movements. So yeah, agree completely. It would be up there with one of the biomechanical risk factors. Yep.
And it tends to go a little bit unnoticed, doesn't it? I think. I don't know. It's one of those ones that just hides them there.
Yeah, probably you don't look for it. It's you don't see what you don't look for, I suppose. Yeah.
Yep.
We got
Irina.
Irina.
I think, yeah.
Yeah. So again, come back to my session with Craig Turdham and our discussions about stress fractures as well. I like all physios telling, and Craig was telling me that bone recovery happened between 24 and 48 hours. And what I took from this, I'm giving my athletes more than 24 hours recovery from training session, from vertical load at the track. So I'm not doing track session day after day. I have day off between track sessions that help in bone recovery. It's what I found from my experience.
Yeah, nice.
Corey's got some comments as well. You there, Corey? No, he put them in the comments.
He's put in the chat.
Oh, he's gone. He's
if anyone
gone. I
wants to
see.
jump up.
I think I'll just keep this going a little bit, but I think everyone's said some things in terms of exposure to to the different sports and then the recovery as we touched upon there, so their ability to handle those repeat loads. Another one that in terms of risk factor I'll just put in there is REDS. So that's lack of energy. So your energy intake isn't meeting your output there, and then what that does in terms of the hormonal challenges, and then the reduction in bone building. So that's a factor that we'll often see there as well. We sort of touch upon, with that recovery, your volume of your session and frequency of sessions, just some other things I'm thinking of. I'll add some more to us, just so we can keep moving on. How then, out of everything we've said, or even things we haven't said, what are people doing when they're planning their sessions, when they're planning their year, in terms of adjusting the training to mitigate the risk of lumbar bone stress?
Very much along the lines of what we talked about earlier, what I talked about. I mean, trying to do it age appropriately. The other thing, actually, bone stress in my event is poor technique. Now, that's easier said than done. Like, pole vaulting is highly stressful on your back, but if you were consistently taking off too close, then that's going to put more pressure on the back. It's a huge deceleration as you take off. But I mean, still doesn't matter how hard you are. People still do things with poor technique and potentially hurt themselves. But yeah. And then that requires more drills and all this sort of thing to try to increase the chances of them having better
So-
technique.
Just exploring that then, Mark, do you hold people back from progressing until they've got a prerequisite ability?
Yes, very much so. So a pole vaulter will normally progress. They will learn to vault off maybe a 4-step run up and then maybe to a 6-step run up once they get a bit better and at longer and longer. And younger vaulters will not run off a long run up initially because they're not able to do it well. And so, yeah, that's what we
Just
main thing.
I know, Matt, you've got your hand up, but I'll let you talk. But I'll just finish with this. So, Mark, or do you then apply those same concepts in the gym as well?
Generally, much lower weights in the gym. That's the issue until the technique is good. So that's the sort of process. Yeah, much smaller weights. Yeah.
So skill before
Skill
load.
acquisition. Yeah, learn to lift with a broom handle before you start, and learn to lift with a weight, and then that sort of thing. Yeah, very much progressive.
Yeah. Matt, we'll jump to you.
Yeah, so with plyometric loading, we do a lot over the last for a long time. We've done a lot of soft sand. So we'll go soft sand to grass and have a period of that through the year in the early phase and do minimal on the harder surface on the track. So we'll periodise that loading and then just gradually build harder surface work in. So we've done a lot of soft sand work on the feet to strengthen, and it's more a technical session of working through, say, hops and bounds and plyometrics in soft sand. And we measure that by time. So we'll measure over 20 metres hopping. And it was like Nicola the other day did the right leg hops over 20 metres on the sand of 2.88 seconds. And on the grass, she gets 2.63 seconds the other day. So it's under 3 seconds for timing that. So the speed you're getting on soft sand is not necessarily slow, but you're working on the technique to efficiently pick up, and it's trying to fire the glute structure around that. And I find that really progresses. And when you work to the track, then to hit the right positions, that comes a little bit naturally rather than just going 100% hard surface on the track to try to create a lot of plyometric load that eventually the body can't handle that, And I've just found mixing that up actually creates more efficiency, and it's quite fast, and it's actually beneficial for the other stuff we do. So I've found that to be quite good. And in the gym, I'm a little bit against, say if we load a heavy squat, we're loading the bone structure, and we'll do another exercise of jumping, like a jumping straight after, but we'll use an air mat rather than a hard surface. So rather than we try to take the load off the bone, but we're trying to get the reactivation through the muscle groups rather than on a hard surface like jumping onto on a force plate, and you're trying to get a result there. What we'll do is just jump up and down fast or hop on an air mat and off, say, for Nicola, say 160 kilo back squat, we'll do that straight away. Yeah. So just a few things like that to reduce bone mass loading, if you like, I think is beneficial.
Maybe leading on from that. I was going to say anything else on maybe following up to Corey's message and leading on from what Matthew was just saying there. Anything else on periodizing of the gym loading, particularly the gym loading into that we know would load the lumbar spine up, that heavy axial loading? And
I found that gym loading will tend to use circuit type lighter loads, especially initially. So you do a little bit more reps, say, but we'll do a lot of ISO holds in that early phase of periodization of the work. So what we're like at the moment with some of the guys that are in that sort of winter period, we've got an exercise, for example, it's a 5-position squat, ISO hold 5 times on the way down, all the way to the ground. So, and I have to count it. So it's because we'll do a set of 5 holds. So it'll be 1, hold 3 seconds, go down, hold 3 seconds. So what you're doing there is setting up stabilizers all through the range of motion. So what I've found when you do that type of movement, that you've had the athletes used to stopping. So when they go to a power clean, they'll catch the load and they get used to not like dropping the hips out as they're trying to catch it and putting their back in a bad position, where you come forward. They get used to being able to stop and hold in variable positions, and you do that early in the early phase of preparation, and then we move on from that. And I've found the power clean side of it has really good benefits of the athlete getting in a good hip position rather than a compromising position where they might suffer injury. As an example, that's all. We used a lot more ISO hold stuff to set up stabilizers and then move to power stuff as we move in where it's quicker.
Very good. Have we got any closing comments, guys? We've gone well over time. I try to keep these town halls within the 60 minutes.
You got any more? I've got a couple of little ones to add, but you got any more pearls there, Richie?
No, you go.
That's everyone has contributed really nicely there. There's plenty of learnings there which we'll add to a list and we'll send up some things. I just think some other ones that just come to mind around that periodization is with bones, they respond better to lots of little loads rather than one big load. So thinking about in your week how you might rather than doing a track session straight into a gym session, are they better off just doing a small track session and later that afternoon doing a gym session or vice versa? That way the bones can reset and it actually helps develop stronger bones down the line, plus less fatigue carried within the session and the ability to maintain nutrition. So you're getting your energy intake before and after each session, so you're more fueled. The other thing is bones love rest as well to recover. So where rest days, complete off days to reset, and then in your yearly plans, where's there space to put many weeks of offloading in there to actually enable, especially in these younger athletes, periods of growth and development and bony development and maturation. We actually find that putting breaks in, whether that's small breaks within a session, breaks within the week, like complete breaks within a week, or larger breaks in the year, actually helps to develop stronger bones in the athlete as well. So there's that part to it, and thinking of your periodization. All right, again, thank you for everyone's comments here. We got Vass. Thanks. One more comment.
Sorry, no, completely unrelated to this. I just wanted a question for both Kevin and I guess Richie. You obviously both mentioned it's pretty hard to, pick these up. Do you guys have any suggestions on how we can maybe as coaches be better at sort of this? Obviously we want early imaging and all of that, but how do we even get to that decision?
Great question, Richie. I'm going to throw to you, but that's a great question, Vass.
And I'll come from a doctor bias. I mean, I guess having, I'm a sport and exercise medicine physician, so I'm going to be biased in that direction, but sport and exercise medicine physicians are probably more likely to pick up on the risk. I mean, maybe to the point earlier, going with if coach is concerned or athlete's concerned or mum and dad, if they're younger, concerned, just flagging that. And even sometimes even being more direct and flagging, you might not know this, but we're seeing a lot of these in sprinters, if it's a sprinter as an example, because sometimes, even that knowledge is probably growing, and probably some of the other ones like the pole vaulters and the throwers, the physios and docs are more likely to be aware of that risk. But there's other groups where you can advocate and say, oh, I'm worried about this and here's why.
Yeah, I think what you'd be looking for as well as athletes that typically one-sided back pain they'll complain about rather than two-sided back pain. So typically that, so if they're saying I've got one-sided back pain that, you know, isn't improving, that's unchanging and tends to be around when they're doing sport or activity, you know, you'd have a low threshold for investigating this. You know, as Richie said, that test that he showed there, that's a common test. And extent, you know, if they got pain into extension and rotation, you're even more suspicious. But I think a pretty low threshold to refer on to a sports physician, not being dismissive to GPs, but it can often be missed if you send straight to a GP. And yeah, I agree with the lady that mentioned before, you know, plenty of physios as well will miss these and treat as standard, you know, as a low back pain and ignoring the great risk that these have if not picked up. So have a low threshold and refer to a sports physician would be my suggestion.